plants grow all over the world. Together they...
You sleep well?
Not too bad.
Are you finished? All families are busy in the mornings, getting their breakfast and remembering to get everything done.
Let me just put that there. Now let's brush your teeth.
But our family has one extra thing to do. We have to remember to give the children some medicine. Both our children suffer from asthma.
Here's your medicine. There's your... You're going to do it yourself?
Yes.
All right, you sure you can do it?
The children have to take an inhaler, and this is a way of getting the medicine that they need down into the chest, where it will do them some good.
That's good. Right, now, let's get on to you, Harry. So you take a big puff now. And hold it at it, lovely, and...
Asthma is a very common condition. At least 1 child in 10 suffers from it. So I have to keep a careful watch on a lot of children at work. I'm a doctor, and Hardeep is one of my young patients who often has a bad chest.
Hardeep Mahal, room 5, please.
This is just a way of checking how bad your chest is. Okay, you take a big breath and you go... When you've got asthma, you find it hard to take enough breath, enough air into your chest to do what you want. What people actually find is that they can sometimes get air in, but they can't get it out again. The peak flow meter is a way of measuring how fast air is blowing out. Well, that's pretty good. That's very good. You sit down again. Right. Now, that's shown that he's wheezing at about 150 on the meter here. Now, he should be doing a bit better than that when he's well. And what I think we need to try and do is to give him an inhaler to take instead of tablets or syrup. Now, the best person who is teaching these things actually is my nurse. I don't know if you've met Sister Anderson.
Right. You stand up to use it then. All right.
One of the things that the nurse has to do is to find out how well Hardeep can use an inhaler.
That's terrific. Can you get the blue one up?
And she measures this with this gadget which Hardeep has to suck on.
Well done.
And it measures really how hard he can suck.
So that gives me an idea of a different sort of inhaler that he'd be able to use.
This way we can decide what kind of inhaler is best.
And here we've got it, and it's called a rotahaler. All right?
Yeah.
And in this little box you can carry all the tablets in it that you need for your day. Okay. Right. I'm going to show you on mine first of all. Right, we take one of these.
The medicine in Hardeep's inhaler is going to help his chest to open out those tiny little airways at the bottom of his chest, which means that more air can get down there, and that means he'll be able to breathe more easily, especially when he has to breathe more quickly, like when he's running around.
Then you can use your fingers if you want to. All right.
Sally has had asthma since she was 2, and she's now 11.
In the last year, it's got worse. I'm not sure if I've got out of it or not. I don't know. It would certainly be nice if I grew out of having asthma, but if I didn't, I know I've got my inhaler. When I was little, if I got wheezy or I felt the tightness in my chest, I used to feel frightened. Even if I did have my inhaler, I used to feel really frightened. But now, I know that it does me good, and I know that I can rely on my inhaler to help me. I use my inhaler usually 4 times a day, and also when I need it. First, when I get up in the morning, at lunchtime, when I come home from school, and just before I go to bed, and any other time I need it, like when I go windsurfing. If you take your inhaler before you go on the water, then you feel more safe. You almost know that you're not going to get wheezy. I try to take my inhaler wherever I go and try not to forget it. I lead a normal life like everyone else, and I just have to learn when to take my inhaler and not to be stupid and not take it, and I lead a normal life.
Asthma is an illness that you need to take continuous treatment for, all the time, every day. There's another common illness that children suffer from that you also have to treat every day, and that's diabetes. Simon is diabetic. That means that his body doesn't make something called insulin, which the rest of us make all the time. Simon has to inject insulin because his body can't make it.
I'm a diabetic, and this means that I've got too much sugar in my blood, and I have to have stuff called insulin. But you see, inside of you, there's a part of the body called the pancreas, and my pancreas has stopped working, which means that it can't produce insulin, so I have to inject myself with insulin, which controls the amount of sugar in my blood. I was about 8 years old when I first noticed that I was diabetic. I was playing outside, and every 5 minutes I just had to sit down because I couldn't carry on and coming in for drinks. My mum thought I was just being silly, but after a while she took me to the doctors, and he took a blood test and he said it's hospital straight away. So I went into hospital and said I got diabetes. First time I did the injection on myself, I thought, this is hurting too much, but the whole problem is if I haven't got anyone there to do it for me, I'll have to do it myself. So I just got used to doing it myself. Yeah. Now I can do it when I'm alone or if I've gone out to friends. And I have to do my injection in the morning and in the evening. After I've done my injection, I have to worry about what I have to eat. If I don't eat enough food, my blood sugar level goes low down, and I start to feel dizzy. I get headaches, and I just feel sleepy and faint. I started off swimming with the school at 6, and I saw them doing the survivals. And that's how I got involved in it. First of all, started off with my bronze survival, worked up to silver and then on to gold.
Right, okay now, close off and make me a float. When you've inflated it, you float for 5 minutes, okay?
The whole idea of the test is so that you know what to do if a ship sank and you were clothed, and if you were swimming and there was oil on the top of the surface, you could go under it, you'd know how far down to go and how far along to swim, and you'd know how to save yourself. After a few years, after I've been training for the survival tests, it was about then that I discovered I was diabetic. I stopped doing the swimming for a few weeks whilst the hospital came and told me what I had to do and how to cope with diabetes, and then I carried on.
After taking exercise, Simon might feel faint and he will need a sugary drink or something sugary to eat. He might even do that before he takes his exercise to stop himself feeling poorly. He has to be careful to keep a balance between the insulin which he injects and what he eats and drinks. And he does this by checking the sugar in his blood. He has to prick his finger and take a small drop of blood, testing it to see how much sugar there is in it.
Having injections doesn't really worry me now, being as I've been having them for 2 years. It does sometimes bother me about knowing that I've got to do it for life now, but I'm grateful that there is a drug, because if there wasn't, I probably wouldn't be here.
Simon has got diabetes for the rest of his life. It's not something that he's going to grow out of. But insulin has saved his life. If he didn't have it, he'd be dead. Most of us are lucky and don't have to use medicines continuously to keep us from being ill. We only need drugs or medicines when we're feeling quite poorly and the doctor decides that we need them to help us get better, and then we get them from the chemist.
Just a minute, it won't take me very long to do.
Medicines are drugs which help to make your body work better. And we must be very careful because they're quite strong and powerful things, so you have to be careful to follow the instructions.
There we are, that's Jermaine's tablets. Now, make sure he has something to eat before he takes the tablets, otherwise it'll give him a little bit of tummy ache. Hope you're soon feeling better.
Thanks.
Bye-bye, Jermaine. Bye. Good morning.
Manjit has an infection and her doctor has prescribed a medicine which will kill the germs that are causing the infection. Now, with medicines like antibiotics, it's very important to finish them so that all the germs are killed. Medicines from the doctor are always meant just for you. They're not meant for anyone else. You have to be sure that you only take your own. If you take someone else's, you never know what might be in it. It might not be very good for you at all. All medicines are kinds of drug, but not all drugs are medicines. A drug is something which has an effect on your body. It might be a good effect, when we would call it a medicine if it does something good for you, or it might be a bad effect. One of these people is taking a really dangerous drug. Can you spot what it is?
Thanks. Do you want a crisp? Thanks.
A cigarette is a kind of a drug, and it can kill you. It's addictive, which means that once you've started to take it, it's very difficult to stop. Another drug that's bad for you is alcohol. It has lots of bad effects on you, particularly on the brain. You have too much of it and see what happens. It's not very funny, really. People usually start using bad drugs like alcohol and smoking because their friends do, and it seems harmless at first. In fact, it seems a lot of fun. It's only later on that they start to get problems from them, when they find that they can't stop using them. If you keep on doing it, you get into more and more trouble. Sometimes people use not just alcohol and cigarettes, but illegal drugs like heroin and cocaine, which are injected or smoked. These are very, very hard to stop. With a drug that you're addicted to, like heroin and cocaine, you need more and more and more of it. And it can get very, very bad until you become seriously ill and you perhaps even die.
Remember that there are good drugs and bad drugs. Good drugs help you, and they're given to you by an adult that you can trust, like the doctor or the chemist or your parents. Bad drugs don't help you. Taking them is just asking for trouble.